Okay, after you've done some of those dynamic pelvic hip opening exercises, now we want to get specific and really prepare those back muscles for whatever the activity might be. Again, we've talked about the inner core muscles, and we talk about those little multifidus muscles. Those are the ones we're really going to focus on next. Interestingly enough, we'll give you a little background about the multifidus. In the case of pain, injury, dysfunction, these muscles tend to shrink reflexively. And when they shrink, like most muscles, they're not as strong, okay? Now this is not something you can normally see or tell, but there's been a lot of research done with ultrasound studies, and they can see this happens within 24 hours of an injury. And they don't necessarily return to their normal size without specific exercises and exercise instruction. That's why people are more prone to recurrent episodes of back pain. Now you can imagine in the case of like a knee injury, if you have an ACL injury or a knee surgery, you can see like, wow, you know, that leg is significantly smaller as it goes through the rehab process. So it's obvious, and you know, okay, we need to do extra work for that muscle. When it comes to the back, you can't really see those muscles and you can't even really feel them, so you wouldn't necessarily know that there's any dysfunction or injury present, and you definitely wouldn't know that they're half the normal size. However, we do know through research this is true. So assuming this is true, and assuming you've had an episode of back pain before, you need to make sure these multifidus muscles are ready for exercise. Now, the theory behind this is when you exercise a muscle, it gets what we call the muscle pump, right? Blood goes into the muscle, it gets bigger because of that blood, and it takes up more space. When we look at how the core stabilizes, remember we've got that thoracolumbar fascia that attaches to our transversus and it goes all the way around. Well, that tissue also encapsulates the multifidus muscle. So as it gets bigger in size, it helps pull that tissue tighter, which again stabilizes the structure, and the muscle's now ready to fire. In addition, with these exercises we're going to do, it helps activate the glute muscles, which tend to be inhibited in a lot of folks, primarily, again, sitting. So with these exercises, it's designed to activate the glutes and activate the multifidus and prepare those back extensor muscles for activity. All right, now this first exercise, it's probably an exercise you've seen before. It's used frequently in physical therapy practice and rehabilitation, but in this case, we're still talking about our warm-up. So it's just the bridge exercise. What we're going to do, lay flat on our back, arms are by our side, and you're just going to lift the pelvis straight in the air. Now as he lifts his pelvis, he doesn't have to hold it. He can come right back down, and then you do it again. Now the idea here is you're activating your glutes, you're getting a little bit of quadricep, and of course you're getting your back extensors, including those multifidus muscles. I usually do 20-25 reps. If you're a really strong person, and this is easy for you, just put a weight on your stomach. So you might do 10 pounds up to 25 pounds, whatever you feel like you need to really get those muscles activated and ready to go. The next exercise we're going to do is the Superman exercise. So we'll have him flip over onto his stomach, arms are out in front. Now it's important to be careful with your shoulders, so you want to be out at about, not quite a 45-degree angle, but almost. Thumbs are up, that gives more space for the shoulder joint. And then we're going to move our arms and our legs up off the ground, only an inch or two, just enough that you feel these muscles here in your low back activate, and then you go back down. And again, because this is part of our warm-up, we're going to do 10, 15, 20 reps, whatever it takes until you really feel like those muscles are getting the warm-up they need. For me, that's around 15 to 20 repetitions. I don't want to burn them out, I don't want to over-fatigue them, but I do want them to experience that muscle pump and to get that blood flow into the muscle to help stabilize that spine. This is particularly important if you're going to be doing weightlifting or crossfitting activities that will involve squatting, deadlifts, picking something up off the floor, but it's also important for those runners and other sports that involve running, because again, you're activating your glutes and you're preparing those back extensors to fire during their exercise that they're going to be performing. Okay, now you can see how important I think the warm-up really is. And speaking of the importance of the warm-up, we need to look at what were you doing before your weightlifting activity, before your CrossFit WOD, before you're going to go run your 5, 10, 15 miles. If you just rolled out of bed, well, then that warm-up is really important. The discs actually have more fluid first thing in the morning, so for the first hour or so, you're more apt to have a disc-related injury than you would be other times of the day. The same thing holds true if you're going to exercise in the afternoon or the evening. What have you been doing all day? Have you been sitting at a desk, sitting in an office, in a meeting, whatever it might be? If you've been sitting and sedentary for a good part of the day, you're at increased risk of hurting your back when you go out to do that activity or exercise. If you're a manual laborer and you've been working all day and you're pretty warmed up, assuming you're not over fatigued, you're probably more ready for exercise than the average person. So depending on what you've been doing before your activity, sport, exercise, that warm-up is critically important. After you go through the cardiovascular warm-up and the dynamic warm-up, you need to take kind of a self-evaluation of how you feel. If you still feel tight, you still feel restricted, you need to start that process over again. You need to go back through your cardiovascular warm-up and you need to go back through more of a dynamic warm-up. You need to make sure your body's ready for exercise. It will improve your performance if this is an event such as a race or an athletic competition, and it'll just improve your performance when it comes to that specific exercise. And remember, it's quality over quantity. So you need to get those good quality exercise sessions in. Once you do your dynamic warm-up, now you're going to go into that sport-specific warm-up, whatever that might be. If you're weightlifting, that means you're going to go through the sequence of events for that particular lift. If it's a squat, put the bar on your back, go ahead and get going on that squatting motion just to make sure you've got full range of motion. Again, you're checking yourself and your body's state for performance. If you're going down to squat and you can't get into your full squat because you're still tight in your hamstrings or in your glutes, well, that tells you need to get back into your warm-up. If you're going to do a power clean, a deadlift, whatever it is, go through the sequence with a light amount of weight. Make sure your body is ready for that lift. If you're a runner, this is when you're going to add those running drills, your butt kickers, your bounding, your skipping, your high knee running, whatever it might be. If you're a soccer player or a football player, you're going to go through some of those sport-specific cutting drills. If you're a basketball player, you might try some full-speed layups. Whatever it might be, that's where you really dial it in for your specific sport. Okay? After we've talked about the dynamic warm-up, the sport-specific warm-up, we've talked about to make sure your back and those multifidus muscles are ready. The next thing to do is you've done your event, you've done your activity, you feel good, you gotta cool down. The cool down is equally important. A real common issue is someone does a high-end event, a run, a CrossFit WOD, really lifting some heavy weights, and then they go and sit. They go sit in their office. They go sit in their car. They got to take a long car drive after the race back home. Then you get out of the car, you get out of the office chair, and your back starts to hurt. It's because you didn't cool down properly. So the cool down is really important. The first thing you need to do with the cool down is keep moving. Don't stop moving until your heart rate is near its normal baseline. So if you're running and you just finished that run, walk. Maybe it's a quarter mile, maybe it's a half mile. Whatever it is, keep walking until your heart rate's back to its normal baseline. If you've just done a CrossFit WOD and you're exhausted, I know it's real popular, you want to lay down on the ground, fine, lay down, catch your breath for 30 seconds, and then get up and move, walk it off. And you keep walking, you keep moving till the heart rate's down. Once your heart rate's down, this is the perfect time. For me, I like to spot train. Is there anything that's kind of giving me trouble? Is my hip bothering me? Do I need to use the foam roller to warm it up? It's also a great time to static stretch. We never static stretch prior to exercise because it can actually decrease performance. But after the exercise is a perfect time to static stretch. We can use the foam roller to work out any of the tight areas. It can help bring blood flow back to the area, release any myofascial or muscle restrictions that might be present. I get the question about the foam roller a lot as far as can you use that as part of your warm-up? The answer is yes. Using the foam roller as part of your warm-up is perfectly fine. It does not impede performance. Don't overdo, but it's perfectly fine to do that as far as part of that warm-up sequence, and definitely as part of the cool-down sequence. So we keep moving, we spot train as needed, and we definitely do our stretches as part of our cool-down.